It's such a thrill for me to be able to say that the President of the United States came from Hawaii in the 50th year of statehood and was elected to the presidency of the United States, and he and this Congress is going to bring national health care reform on his desk to be signed this year. And this meeting is going to be an intricate part of it. It's a marvel. It's something that we've hoped for and dreamed about and met about, and I'm sure many in the audience are thinking tonight, my God, how many of these meetings have I been to? How many discussions have been held? The difference here is that the President very shrewdly has decided not to present a plan per se of his own to the Congress, where it immediately gets chewed up and worked over and nobody has any sense of ownership of it, but rather, having stated the principles of health care reform as he sees them, has then pushed it to the Congress and here, you come up with the proposals in legislative form, and let's set a timetable for ourselves and let's do it. We intend to have a bill, it is our intention in the House to have a bill on the floor and passed by the time we come to the August recess, so we can come back to you again with the proposal, again to get grassroots feedback as to where we're going, what we're going to do. So we're going to try and gain a provider's perspective on the health care crisis. We're going to receive your feedback and current ideas discussed in the Congress. I do want to state a couple of things that are driving the House presentation to this point. Obviously, there's a health care crisis, but there's been a crisis for half a century. And the crisis takes different forms and different elements of intensity at different times. But there is no question, given the economic meltdown that has taken place in the wake of the Bush-Cheney regime, that it is more acute now than ever any time since the Depression. The insured and uninsured are facing daily worries now. The fact that one may have health care insurance of the moment is no guarantee that you're going to have it tomorrow. Try being an auto worker in Detroit, and you'll get the message on that very, very, very quickly. Or try being someone here in Hawaii with a health care plan associated with a business that you thought would be here solid and stable and with a future, and then suddenly finding it going belly up. And not only the health care side of it, perhaps even disappearing, but pension destruction, actual destruction of pension possibilities with it. And so you can see that whether you're in small business or big business, this is a crisis that needs to be met. We also know, obviously, that we all pay for our broken system. The state and federal government now pays about 75% of the uncompensated care, while those who are insured pay higher premiums. Families pay, and there's just a study out that I don't believe we had an opportunity to get into the handouts. Just within the last day or two I got it. The studies are indicating that there is roughly $1,100 in premiums each year to the average family, in addition, just to pay for the uninsured. We simply cannot stay on what I consider to be an unsustainable path. So, what do we know, real quickly? The health care costs have been rising. Even though Hawaii has the prepaid health care plan, a substantial problem exists with uninsured adults. Approximately 1 out of 4 adults under 65 in Hawaii is now uninsured. Now that simply was something we didn't contemplate even 5 years ago, let alone a decade or so ago. One reason has become premiums have dramatically increased in relation to wages. Without reform, I can tell you, premiums will continue to burden our families and business. Congress has principles that we think are going to guide us in this process. We want it to be fully paid for. Health care reform that is brought forward has to be fully paid for. That's part of us trying not to drive the deficit even further than it is, or the national debt deeper than it is. That's a tall order for us to try and address health care reform in the midst of this disastrous slide into national indebtedness and to heavy-duty deficit spending, which obviously includes wars in Afghanistan and Iraq and other disasters of the United States policy. So cost, quality, and access have to be addressed as well while we're trying to deal with having the reform fully paid for. So some of the goals we have then, if you have a plan you like, you can keep it. If you don't have insurance, you're going to need to be covered, and unemployment is not going to be a barrier to being fully covered any longer. So that moves us to the question of a public plan. The public plan, as it evolves, will promote competition, it'll guarantee choice, it's going to ensure transparency and accountability in insurance, and it's going to be portable. Competition, I think, is good in this regard, and I think that it's something that politically is unstoppable at the present time. We're going to invest in prevention and wellness and reduce long-term care costs in federal programs such as Medicare and Medicaid by promoting prevention and wellness, and that may get into some very interesting ideas of what we're going to do about obesity and how we're going to address that question. It's going to get in some interesting discussions about not just the beginnings of life, those kinds of arguments and confrontations that take place, but also how we deal with the end of life. Are we extending life or prolonging death? Those are questions that are going to have to be addressed, and they're going to have to be resolved in any plan that we have. Then we want to utilize patient safety measures and provide incentives to improve the quality of care. Bonus payments have been brought up. You'll need to address that. In some respects, believe me, I'm a layperson in that regard. You deal with these issues every day, and we're going to need your input on the improving of quality.